Welcome to this brief module series on analyzing ASQ data and what to do with it afterward. My name is Dr. Gayla Loafing from the Southwest Plains Regional Service Center. There are 4 modules in this series, with the first one being a brief overview of the ASQ3 and the ASQ SE2 assessment tools. To begin this review, we need to look at the Kansas CAN initiative, which began with our current Kansas Commissioner, Dr. Randy Watson. In October 2015, the Kansas State Board of Education announced a new vision for education in Kansas, giving direction for a student-focused system and resources for individual success. The board identified kindergarten readiness as one of the 5 outcome areas to measure progress and now expects every district in Kansas to utilize a developmentally appropriate snapshot tool. The goal of kindergarten readiness is to ensure that each student enters kindergarten at age 5 socially, emotionally, and academically prepared for success. The Board of Education determined that to do this, Kansas needed to have common kindergarten entry data sets across all elementary schools. The ASQ assessments were selected to gather that data. So now, every elementary school must administer the ASQ3 and the ASQ SE2. These tools are parent-completed questionnaires and provide a kindergarten readiness snapshot. It is important to see the tool's results as a means of a brief developmental screen checking, similar to milestones a pediatrician would use to check for wellness baby checks. The results are considered a snapshot to see which children are developing as expected and which ones may not be. This is a mind shift for many of us in 3 big ways. Typically, as teachers, when we consider screeners, we think of Ames Webb or DIBELS. We think of benchmarking and progress monitoring. The ASQ questionnaires do not diagnose delays or disabilities. They do not identify specific goals or benchmarks. Instead, the screening results offer information about a child's key general skills. The big idea of employing such a statewide initiative is that some children who are underdetected may not get appropriate follow-up needed to support their development and learning. Please know that using the screening results are not being used to deny entry to kindergarten, nor are they high-stakes testing purposes for qualifying children for special education. Knowing the why or the purpose of the tool is important. Secondly, these questionnaires ask our parents for input regarding their children. When have we ever done that in the past? It's a huge validation of parental knowledge. It's a huge beginning to telling our parents, we want to begin this educational partnership with you. It's a huge beginning to value that we as schools are placing on our stakeholder relationships. And thirdly, the what we do with this assessment data relates intentionally to our teaching and our choice of curricular resources. As mentioned, it's important to remember that these results will show us that most of our children are on target developmentally and doing great. Some will benefit from practice in specific areas or have other family supports, and a few will need additional supports. The tool designers provided evidence indicating parents are the experts on their child, and that by partnering with teachers who are experts on developmentally educational norms and ways to facilitate learning is a powerful collaborative way to foster a child's learning. As a brief overview, please recall there are 2 questionnaires. First, the ASQ3 covers 5 areas or domains of development to check on to see if the child is progressing. These are in the areas of communication, gross motor skills, fine motor skills, problem solving, and a child's personal social learning. For most of us as kindergarten teachers, we will employ the specific ASQ3 age interview questionnaire of 60 months. However, the 72-month interview questionnaire may be appropriate for some children. The Kansas Kindergarten Readiness Snapshot uses the 60-month interval questionnaire for children who are between the ages of 4.5 and 5.5 years old. Remember, these intervals are just considered milestones and not givens. Within each ASQ3 area, there are 6 questions about skills and milestones in that domain of development. Parents choose from 3 response options, which are scored differently. Questions are written simply and do not exceed a 4th to 6th grade reading level to ensure that most parents can understand and respond. Each of the questions includes simple examples to illustrate the target skill for parents, and the questions are ordered from easiest to hardest. Question 5 and 6 are average skills for a target age. For example, for 60-month skills for a 60-month-old child, though the administration window or the age range is wide from children who are between 5.5 to 6.5 years old. This is what the information summary forms look like. It's important to remember that each age interval questionnaire has its own unique information. However, each summary sheet has 5 key sections, including a child family information section, a bar graph, an overall section summary, what follow-up actions may be taken, and individual option item responses. The ASQ guide notes that there may be additional considerations in reviewing a parent's response, particularly in terms of cultural values and parenting practices. To explain, some cultures do not encourage self-feeding or children dressing themselves, so these skills may emerge later than in Western cultures. Also, in some cultures with strong oral traditions, writing may not be emphasized, especially at young ages, and it may also be considered a safety concern. Furthermore, some cultures place a high value on socializing and may not encourage solitary play with toys. Likewise, some cultures may have strong gender roles and not allow or encourage girls to participate in sports activities. This brings into importance the value of partnering with your families and gaining awareness of their cultural, historical, and community backgrounds as you collect their data. Now, let's briefly review the ASQ SE2 questionnaire. This is an easy-to-use tool with a deep, exclusive focus on children's social and emotional skills and behaviors that are important and targeted skills for school readiness. The interview results allow professionals to quickly recognize children at risk for social emotional difficulties or in need of further assessment. It is meant to identify behaviors of concerns to families. It too is a parent or caregiver completed questionnaire, and it shows cultural sensitivity to families. The ASQ2 was developed as a companion tool to the ASQ3 and focuses on big ideas like regulation by asking, when upset, can your child calm down within 15 minutes? Or by asking about a child's compliance. Does your child follow rules at home or at childcare? It also asks parents about their child's adaptive functioning by asking, does your child sleep at least 8 hours in a 24-hour period? As well as about the child's autonomy by asking, does your child explore new places, such as a park or a friend's home? Other big ideas on the questionnaire include affect, social communication, and interaction with people. By asking such questions as does your child like to be hugged or cuddled? And does your child use words to describe his or her feelings and the feelings of others, like I'm happy or she's sad? Does your child take turns and share when playing with other children? The why of the ASQ SE2 was developed in a way so as to alert educators of an early identification of issues essential to building children's confidence and to reducing the likelihood of later serious behavior and mental health problems. Research has shown social emotional issues can affect a child's and a family's well-being. Young children's ability to successfully regulate emotions and interact with others positively is critical for school readiness. Unfortunately, the prevalence rates of social emotional behavior problems in young children are expected to approach 13%. Research also denotes that 1 in 5 children in the U.S. has a diagnosable mental health problem, and most do not receive services. In some cases, this is because services are not accessible, but often it's because the child's needs have not been identified. Now, let's look at the actual ASQ SE2 tool. Please note that items are not organized in sections or areas of development. That's because they are all in the social emotional domain. Each questionnaire reflects the 7 behavioral areas mentioned earlier. Open-ended questions are not scored, but the open-ended questions, just like on the ASQ3, are very important. Referrals are often made based on an answer in the overall area, regardless of what the total score is. The teacher will want to talk to parents or caregivers about any concern that is brought up. Reviewing and analyzing the ASQ results will be considered specifically when we view Module Number 2. Like the ASQ3, each ASQ SE age interval has its own unique information. Summary sheet. The information summary provides a quick look at the ASQ SE2 results as well as follow-up actions. The information summary sheet provides a complete summary of the question information and results. Different parts on the sheet include the age interval, age range, child and family information, scoring chart, scoring graphic, a summary of overall responses, and any follow-up considerations or actions. An optional individual item response section may be completed so that all the information from the screening is contained on one sheet. There are points for educators or providers to remember when looking at both the ASQ3 and the ASQ SE2, particularly in terms of the cutoffs on the 2 assessment tools. Remember that on the ASQ3, a lower score reflects a greater concern, but on the ASQ SE2, the higher score reflects the greater concerns. Teachers or providers must also consider that parents may overuse the sometimes column, and this may result in an inflated score. You may review those items and rescore with the parent if appropriate, but be careful not to impose your perspective. Some subjectivity is inherent in the design of the ASQ SE2. It may be useful to get input from other caregivers. An alternative caregiver or professional may complete the ASQ SE2 to see if that offers additional insight. However, such an adult should spend 15 to 20 hours or more each week with the child to know him or her well enough to complete a questionnaire. In our second module, we'll look at the reporting and the analysis of the parent's input. As a teacher or provider, your main task will be to review and interpret the results and generate relevant reports to help you understand and then do something with the results. To review, when considering the doing something with the ASQ, the teacher or provider should first focus on recognizing the value or partnering that is occurring because of the parent's input in this assessment. By talking to the parent about their child in terms of his or her strengths and noticeable concerns, and then very importantly, thinking about how to intentionally embed or integrate the big ideas on the ASQ3 and ASQ SE2 assessment in terms of your teaching and your curriculum decisions. To help you think more about the parent partnering and beginning that collaborative process, please look at handout number 1. Accompanying the ASQ2 are parent activities that you will want to look at. Review it and consider how it might look in your classroom.